We will continue discussion of the last PowerPoint in this PowerPoint. We can't talk about epidemiology and the association with public health nursing without talking about the father of modern day epidemiology and how epidemiology was founded. There's actually no better example of understanding the relationship between a risk factor and a health issue um, than what John Snow found in the mid 1800s in London. For unknown reasons at the time, there were many people in London that began to suffer and die as a result of cholera. Cholera is an infectious pathogen that can actually cause severe diarrhea, and then people died. People were actually fleeing the city because of fear, and there was not a known cause. So they had little confidence that the disease could be stopped or prevented. John Snow actually created a map that began to identify where the deaths from cholera were occurring across London. This led to what is actually a now famous map that yielded some clues for Snow, because he managed to visualize the areas where deaths were most heavily concentrated. He suspected a water source, so to prohibit people from accessing the source of risk, he actually removed the water pump handle. In 1854, physician John Snow actually convinced a London local council to remove a handle from a pump in Soho in London. A deadly cholera epidemic in the neighborhood comes to an end as he mapped the outbreak to prove his point. In the 21st century, public health nurses continue to solve mysteries in identifying and eliminating health risks. And although conditions have improved in many parts of the world, reducing the risks from unsanitary conditions, these improvements are actually not universal. So I want you to consider the difference between developed countries and what we handle and deal with, as opposed to developing countries. Many developing countries still face problems with cholera. Many developing countries still face problems with vaccine preventable diseases. We have people in the United States that travel to developing countries. So there is always the risk that they can bring the diseases back to the United States that we may not see very often. It's actually really incredible that after more than a century since Snow solved the initial mystery, public health nurses continue to seek clear answers and solutions regarding the risks and diseases that are present in public health settings across the globe. In the United States, public health nurses face complex challenges in meeting the needs of individuals, families, communities, and population. Nurses need to identify risk and protective factors at multiple influencing levels. For example, a nurse might be working with a child recently diagnosed with asthma. The nurse needs to identify risk factors in the family environment that might be triggering for asthma episodes. Similarly, the nurse needs to assess for protective factors in the family, such as parental commitment to preventing episodes, which is an important asset the nurse can support with education and related tools. The nurse may actually want to go further and explore the neighborhood, including collaborating with school personnel or looking for risks for protection. It can take time to carefully and thoroughly assess risk and the protective factors using a strengths-based approach. Usually, the time is well spent because the public health nurse will have a very clear picture of available assets as well as deficits to address when intervening on a particular issue. Doing this proactively as a critical approach is actually a critical part of health promotion. Conducting assessments of risk and protective factors after a health issue has become apparent is important to minimize the effect of health problems and to encourage positive intervention results. Public health nurses continually assess for risk and protective factors because these factors can temporarily exist or can temporarily improve or disprove. It's very important that public health nurses commit to efforts that routinely assess, intervene, evaluate, and reassess. Public health nurses also need to stay informed about emerging diseases and pandemic threats. For example, in 2015, pertussis cases decreased by 37% as compared to 2014. In the case of pertussis, a public health nurse would recognize pertussis vaccination, which was re-implemented in 2014 with new standards, is a protective factor. A lack of vaccination, waning immunity of vaccination, and posing immunocompromising conditions would be risk factors. These are all things that a public health nurse needs to think about and to consider when they assess and reassess. As a public health nurse, you're going to need to know how to find and use data. Data will be your best friend. Data drives much of what we do. In fact, we actually determine health priorities by using data to identify key problem areas or concerns. We also use it to evaluate whether interventions or programs are working or not working within our community. The problem is, data is not always easy to interpret or understand. It's often presented in formats as tables, figures, or graphs, or raw numbers. It may be posed as percentages or risk ratios. Although in-depth knowledge of data formulas and calculations is not necessary for a public health nurse, it is necessary that you understand and have a general vocabulary when it comes to data. Often, data are presented over time by using graphs to show what is happening in a community with respect to a particular health problem or population trend. For example, a public health nurse might be interested in exploring trends related to a specific infectious disease over 5 years, or they may want to compare this 5 years to the last 5 years to the last 5 years to see if trends are decreasing or increasing. The data in the graph provides a snapshot of how the number of cases are doing in terms of increasing or decreasing. Data can actually also be in a trend per 100,000. A public health nurse might examine a trend of chlamydia cases over a period of 5 years. Rather than looking at the raw number of cases, the public health nurse might prefer to examine rates of cases, which is always based on a ratio or number of cases per 100,000. The raw case number does not actually give a picture of how serious the problem is. This is why we use rates. When we have two different size populations, so in Ohio, we've got a county that has 14,000. We also have a county that has 89,000. If we had 5 chlamydia cases in both counties, it would be worse in the 14,000 population. That's why we use rates. When we use rates, we set populations in comparison of one another. We can understand the rate of an urban population as opposed to a rural population if we put disease rates within the 100,000. It's why a lot of times you see rates, because it's a much better understanding and description of what's going in the population, what's going on in terms of the population. Comparing health and disease trends across communities can be challenging and actually create turmoil if it is not done carefully. No community wants to appear worse than any other community when it comes to health problems or conditions. On the other hand, if resources are scarce, a community might want to justify acquiring greater access to certain things. Careful comparison of the data within and across communities is vital to ensure that public health priorities are appropriate and that the chosen resource allocation is warranted. Comparison is useful because it can bring an understanding of severity or scope of a problem, especially when we're talking to policymakers that may be unaware that the problem even exists. To understand the context from which our client originates, a public health nurse might be interested in disease incidents in other parts of the world. A public health nurse that graphed TB cases within their county and compared them to other cases within their state and then within the nation might find very different rates of tuberculosis. Because of this, it may inform their decisions and actions. So it's very important to understand the population trends that are not just happening within our community, but within our state, within our nation, and then globally. When we talk about population trends, it's actually really important to consider how they compare year to year. It can be valuable in determining the public health interventions, particularly when resources are limited. Population data are important because they often give a glimpse into the bigger picture of how people are distributed, but the data by themselves may not be sufficient to guide intervention or decisions or justify program budget priorities. When we're talking about population data, we're talking about population pyramids. This means that we do age groups and we rank them. Normally, it's a pyramid with most being at the bottom and least being at the top. If we have inverted pyramids, it can put stress on a community. If we've got a stacked pyramid, it can put stress on a community. If you have any questions about population pyramids, I suggest that you Google a population pyramid for the United States or for your community. Another very common tool that is used to examine data regarding risks and health outcomes is a 2x2 table. This table aids in understanding how disease is distributed in a population based on the presence or absence of a risk factor. From this table, a public health nurse can calculate the rate of disease in each group, or the risk ratio. The risk ratio is the rate of disease for those with risk behavior divided by the rate of disease for those without risk behavior. And the odds ratio, or OR, is regularly used to describe the likelihood of contracting a disease for someone with a risk factor compared to someone without.